Welcome everyone to Space Monkey, Measuring STD Program Budget Impact. My name is Leandra Lacey and I'm the Manager of Capacity Building for the National Coalition of STD Directors, or NCSD. This is just a reminder that this webinar is being recorded and the recording will be made available. I have muted everyone's lines just to prevent any kind of background noise, so we should be good on that end. But if you do have questions or need technical help during the call, you can use the chat function in the bottom right-hand corner of your screen. You can also private message me or my colleague Tiffany Haskell, who's listed as a host. And all questions will be addressed at the end, but we will keep a queue, so please keep them coming as you think of them, and we'll tackle them at the end in the chat box. So the webinar today has three main objectives. The first one is to provide details on the purpose of Space Monkey and how the tool works. The second is to highlight ASTO and NCSD's customizable fact sheet created to accompany the tool. And then lastly, describe how the Arizona Department of Health and the Texas Department of State Health Services have used Space Monkey with both internal and external stakeholders. So, to fulfill these objectives, we'll have Dr. Harrell Chesson from DSTDP discussing what Space Monkey is. We'll next have Elizabeth Rubish from the Association of State and Territorial Health Officials, or ASTO, discussing the fact sheet that I mentioned. And then we'll have those examples from the STD field coming from your peers, Rebecca Scranton and Kaitlyn Sykes in Arizona, and then Amanda Reich in Texas. And again, we'll have time for questions at the end. So we'll go ahead and get started with our first speaker. Dr. Harrell Chesson is a health economist in the Division of STD Prevention at the Centers for Disease Control and Prevention. He earned his BA in Economics from the University of North Carolina at Chapel Hill in 1990, go Hills, and his PhD in Economics from Duke University in 1996. He joined CDC in 1996 as a Prevention Effectiveness Fellow. He has published numerous studies of the impact and cost effectiveness of STD prevention activities in the United States. Harrell, I'll let you take it away.
Okay, thank you. And thank you for the opportunity to talk about what is Space Monkey and how does it work. So what is Space Monkey? Space Monkey is a spreadsheet tool that we developed to help STD prevention programs estimate the impact of changes in their budget. And I think one of the best things about Space Monkey is that it's evidence-based. So we take information from published studies of the impact of STD prevention funding and activities. And what Space Monkey does is provide estimates of the impact on health outcomes of changes in the budget. And the health outcomes we look at are syphilis, gonorrhea, chlamydia, and HIV infections that are attributable to these three STDs. And in addition, Space Monkey also provides estimates of the impact on the direct medical costs associated with these outcomes. So what does the name Space Monkey mean? The SPACE stands for STD Prevention Allocation Consequence Estimator. And we meant it to be like Survey Monkey, but some people were disappointed that the monkey didn't stand for anything. So we added the modeling outcomes not known exactly yet for those who want monkey to stand for something. So why was the Space Monkey tool developed? We developed the methods here at CDC, and then we had some contacts from state and local STD prevention programs asking for guidance on how to go about estimating the impact of changes in their budget. And since we had these methods developed, we thought it would be nice just to put it into a spreadsheet tool to make it easier for programs to apply these methods. One of the good things about Space Monkey, we think, is that very little data are needed in order to use Space Monkey. Specifically, you can get results from Space Monkey if all you have is information on the size of the population served by the STD program, the reported number of STD cases and for chlamydia, gonorrhea, and syphilis, and the amount of the budget decrease or budget increase that you want to analyze. So with just this information, Space Monkey is able to give you estimates. And Space Monkey uses two different methods that I'll talk about a little later to estimate the effect of budget changes. One method is based on published studies of the effect of STD prevention funding on STD rates, and another method is based on a published study of the effect of disease intervention specialist or DIS activities. And although it's not required, if you want to enhance the second method that examines DIS activities, you can enter information about the DIS in your program, such as the number of DIS, their annual salary, and how many patients they interview each year. So now I'll go through a quick demo of what the Space Monkey Excel program looks like. So you start off with the introduction screen, which is, I guess, standard. Then the very first screen is when you enter the basic information that I just mentioned, such as the size of the population and the reported number of cases. The numbers I'm showing here are for a hypothetical state, but it's what the hypothetical state would be if the United States were divided equally into 50 parts. So, you know, they have 1/50th of the STD cases and 1/50th of the population. So in this example, we're going to look at the $200,000 budget decrease, and we want to know what impact that will have. Here is the screen where, if you would like to, you can enter additional information on your DIS activities. You can leave the whole screen blank, or you can enter one or more pieces of information. Then we have a screen here just to let you know that your results are coming, so you won't be surprised. And then on the next screen, you will get your results. And what the results show are 10 years worth of results. So each row shows 1 year into the future, going from year 1 through year 10. And the bottom row is the total across the 10 years. And as you can see in the columns, what it does is show the percentage increase in STDs due to the budget cuts. Then it shows the additional number of infections from syphilis to gonorrhea and chlamydia, and then the number of STD attributable HIV infections. And then the final 3 columns show cost information about the increase in direct medical costs as a result of the increase in STDs. And then there's also a text section, so it helps to put these increases into context. So if it helps to have this for you, you can copy this and paste it into another document to use. And there's also an advanced options menu. We wanted to make it as simple as we could, but if you do want to change some of the background assumptions, for example, or get more information, or see some of the other features, you can do that. And just to briefly show you what the calculation methods are, as I mentioned, one was based on the studies of the impact of changes in prevention funding, and those studies suggest on average that each $1 change in the budget per capita reduces or changes STD rates by 16%. And that's the main piece of information that Space Monkey uses in the first method. In the second method, what we do is calculate what impact the budget change would have on the number of DIS, and then, as shown in the third box, we base the calculations on what the published studies have shown us about the effect of changes in DIS activities on STD rates. And if you would like to read more about that, there is the source listed there at the bottom. So to summarize, it's not an exact science to estimate the impact of budget changes, and it's difficult to estimate with precision, but we do think Space Monkey can provide reasonable estimates based on published studies. So we think this is a good way to get evidence-based estimates of the impact of changes in the budget. And Space Monkey makes it easier for programs to use this evidence to estimate the health and direct medical cost impact of budget changes. And although I did not present it today, I just want to make sure you are aware that another related tool is available. The stick figure spreadsheet allows the programs to estimate the direct cost and productivity losses averted by their program activities. So thank you for this opportunity to tell you about Space Monkey, and we hope that it is helpful.
Thanks, Harrell. I appreciate that. Getting that background on what Space Monkey is and how to use it, I'm sure will be a great foundation for moving forward. So I appreciate that. Next, we will have Elizabeth Rosebush. She's the Director of STD, HIV, and Viral Hepatitis with ASTO. And she'll be talking about the customizable fact sheet that was created in collaboration with NCSD to illustrate budget impact data from Space Monkey.
Great. Thanks so much, Leandra, and thanks so much to NCSD for having me on today's webinar. Today, I'll briefly share an overview of a customizable fact sheet that was developed by ASTO and NCSD that aims to support your efforts in communicating Space Monkey output so you can maximize the impact of this important data. So for those of you who aren't familiar with ASTO, we're the Association of State and Territorial Health Officials, and we represent the chief executive officers at health agencies in the states, territories, and District of Columbia. At ASTO, much of our work focuses on articulating and effectively communicating the value and role of public health. And in that context, I think the Space Monkey data and communication tool that I'll introduce shortly fall into a larger strategy to raise awareness of the important work that you at health departments do and the critical need for investment. In the fall of last year, ASTO and NCSD launched a customizable fact sheet that can be used to adapt your data outputs calculated through Space Monkey into a visual format that we hope is also appealing to your audiences. The fact sheet can be used to communicate the impact of STD program funding to your target audiences, and these audiences might be providers, members of the media or public, and decision makers, and we encourage you to think of these decision makers as both internal and external to your health agency. We encourage you to share the fact sheet on your social media channels, on websites, or printed as leave-behinds at meetings. Here you can take a closer look at the layout of the fact sheet. It can be downloaded as a PowerPoint for easy editing, and the customizable portions align with the data outputs from the Space Monkey tool that were just presented. If you go to the web link that should be at the bottom of this slide, and I think will be included in the chat as well, you can find access to the fact sheet itself and the instruction guide that highlights the areas of the fact sheet that can be updated with your jurisdiction's name, local data, and your agency's logo. The fact sheet includes key messages that some of our formative research suggests resonates with leaders within health agencies and external audiences, specifically because these messages demonstrate the economic burden of STDs and the effectiveness of STD prevention programs. They include local data to make the issue relevant to your audience's constituents or their patients or their readers. And they include messages about both the short and long-term impacts of program investments, or the lack thereof, to communicate the immediacy and the importance of acting now to prevent larger issues down the road. There are two pairs of customizable fact sheets. The first pair includes messages about disease intervention specialists, or DIS, and the second set excludes these messages. So depending on the types of data inputs that you use in the Space Monkey tool, you have options for how to present the output. Finally, each pair of customizable fact sheets includes a full color option and a low ink option, and those are highlighted on the slide. The full color option might be preferable for your use on websites, social media, or if you're printing it professionally. The low ink version might be your best option if printer or paper quality is an issue or you're concerned about ink usage. In addition to this fact sheet, we have a growing suite of communication tools for health agencies on ASTO's STD webpage, so we encourage you to check that out at asto.org/STD. And last but not least, we really do help to hear from you to better understand how we can focus our activities to best support your needs. The direct link for the Space Monkey customizable fact sheet is included on this slide, and I think it's also been included in the chat, so thanks for that. So please visit that page and take a look at the fact sheet options. And once you do, we invite you to share your feedback by clicking on the blue evaluation button at the bottom of the page. And it should look like the image that I have on this slide. It'll take you to a very quick survey, and I promise it's short. And I want to emphasize that your feedback really is instrumental in helping us support and refine this work, and if possible, expand it. My contact information is included on this slide. And for any states listening in today who are interested in using the fact sheet and willing to share their experiences with ASTO and NCSD, we'd love to hear your stories and explore ways to feature your work. And speaking of state stories, I'm looking forward to hearing from our next speakers. So I'll turn it over to Leandra to tee up our next set of presentations. Thanks so much.
Thanks, Elizabeth. Now we'll hear some examples from Arizona and Texas on how they have used SpaceMonkey to measure their program budget's impact. First, we'll have Rebecca Scranton, who received her Master's of Public Health in Epidemiology from the University of Arizona in May 2015. She has 5 years' experience working in public health research with an emphasis on understanding the socio-demographic factors associated with disease transmission and health behavior. In 2016, she worked as a data analyst for Maricopa County Department of Public Health, conducting disease surveillance and emergency preparedness activities. Rebecca has been working in the field of STD surveillance since 2017 when she accepted a position as an STD epidemiologist for the Arizona Department of Health Services. In January 2018, she was promoted to the position of STD Control Program Manager. Rebecca has a range of qualitative and quantitative analytical skills. She works with her team and partners in STD prevention to closely monitor the trends of STDs in Arizona and uses data to inform targeted STD prevention efforts. Kaitlyn Sykes, Rebecca's colleague, will be joining her. Kaitlyn received her Master's of Public Health in Epidemiology from the University of Michigan in May 2016. She has 3 years of experience working in applied public health in both the local and state health department settings, with an emphasis on the interplay of behavioral health and infectious diseases. Following graduation in 2016, she worked as a CSTE Applied Epidemiology Fellow at the Maricopa County Department of Public Health, conducting surveillance on behavioral health, specifically substance use. Kaitlyn has been working in the field of STD surveillance since 2018 when she completed her fellowship and accepted a position as an STD epidemiologist for the Arizona Department of Health Services. She focuses on special projects within the STD control program in Arizona, using data to inform targeted STD prevention efforts through program and policy changes. After Arizona, last but not least, we will then hear from Amanda Reich in Texas. Amanda joined the public health workforce in Texas at the Austin Public Health Department, piloting a linkage to care program for persons living with HIV and acting as a team lead for the disease intervention specialist. While at APH, she transitioned into the quality assurance coordinator role for the DIS program, including reporting congenital syphilis for the program. She began working for the Texas Department of State Health Services as a public health follow-up consultant, providing guidance to several programs across the state, reviewing congenital syphilis case reports, and assisting with database conversion. She currently works for DSHS as a congenital syphilis coordinator, providing statewide guidance regarding congenital syphilis reporting, facilitating and moderating fetal infant morbidity review boards in Harris and Bixar counties, and managing Texas policies for congenital syphilis. Amanda currently serves as the co-chair on NCSD's program committee and is a member of NCSD's Federal STD Action Plan subcommittee. So I will now leave it to Rebecca and Kaitlyn in Arizona.
Hi everyone, my name is Rebecca. I am the STD program manager, and I'll be co-presenting with my colleague Kaitlyn, who is really our jack of all trades. At Epi, she does all of our special projects, including SpaceMonkey. So today we're going to talk a little bit about the background landscape of Arizona, some of our geographical landscape, as well as our case counts, specifically around syphilis. And then we're going to dive into what funding looks like in our state. Then I'm going to pass it over to Kaitlyn, and she's going to share some of the parameters that were used when we were completing the SpaceMonkey and the subsequent fact sheet. And then finally, I'll share a little bit about the voyage of our Arizonan SpaceMonkey, where it's been and where we'd hope to see it go in the next 12 months or so. So just to give a little bit of background in Arizona and the population that we serve, the state holds about a little less than 7 million people. And as you can see, the big red area in sort of the middle of the state is the Phoenix area, and that's within Maricopa County. And Maricopa County alone holds around 60% of our state's population. So quite a large portion of our state lives in a pretty confined area. And then the smaller red area to the southeast of Phoenix is Tucson, which is within Pima County, and that's the second largest population hub. And then really the remainder of the... Okay, I see a comment that the slides are not advancing.
Kaitlyn, can you make sure that sync is pressed in the bottom right-hand corner of your screen? Perfect.
Cool.
Sorry about that.
Okay. No, perfect. Thanks for letting us know, everyone. So yeah, just in general, those are the two largest population hubs, and then the rest of our state is pretty rural, which can lead to some interesting challenges in terms of case investigation, screening, and treatment. Arizona's population has also been growing at a very high rate. We're consistently in the top 5 in the country for population growth rate for the past few years. And about a quarter of our state is actually made up of Indian reservations that serve as the home of 22 federally recognized tribes. So now to get into STDs in Arizona. STDs in Arizona, just like in the rest of the country, have been going up for the past decade. We have seen a pretty steady increase in the rates of chlamydia and gonorrhea, but in 2014, that was when we really started to see an increase in our syphilis cases. And particularly around that time, we began to see a really large increase in our female syphilis cases. This led to, all right, no data. Our data will not show, but I will talk you through it. The increase in female syphilis really led to a huge increase in congenital syphilis in our state, again, just like the rest of the country. In 2017, we had a double in cases, and in 2018, we doubled in cases again. And additionally, we also, oh, there's our data. In 2018, in addition to doubling our case counts, we also had a increase in the percentage of cases with severe outcomes. So, for example, about 10 of our 60 cases resulted in death. And in addition to an increase in case count, we also started to see our cases move more rural. So historically, a lot of our cases, just like our population, were in Maricopa County. But in around 2017, when we saw the cases increase, we also saw a big spread in our cases to our rural areas, which can lead to some challenges in providers who have not seen syphilis in maybe decades. So that's just a brief landscape of our STD data in Arizona.
Can you all press sync once again? Sorry about that. Usually, once you press it once, it's fine, but there we go.
Okay. All right, are we on the slide with the monkey?
Yes.
Excellent. Okay, so the funding landscape in Arizona, we are very reliant on federal funds. Our biggest funder, over 90% of our state funding, is actually from the CDC PEACH grant. We get some additional grants through CDC, however, they make up a pretty tiny portion. I'm hoping that'll be a much larger portion in about a month or two when we hear back on ELC. And then the state gives us just enough funding for 2.5 FTE, so that gives me about 2.5 admin data entry staff. Now we are a home rule state, which means that all the hard, heavy lifting work of going out and finding cases and doing partner services, that tends to fall on our counties. So most of what we get from PEACH, we then give to our county jurisdictions, and we're able to fund about 11 disease investigators from that pot of money. And then each of the counties also has some county general funds that can be used and some funding that's allocated for STD control, but it's a bit harder to measure just what proportion of funding come from the counties. And so that's kind of our funding landscape. We do spend the bulk of our funding on personnel, so this covers our 3 state epidemiologists who are located at the State Health Department, as well as our 11 disease investigators scattered throughout Arizona, and also part of my salary. And then the rest of it goes into maintaining the database, investing in upgrades to accommodate our ever-increasing volume of cases, and getting folks connected to screening and treatment. Okay, are we on the next slide with the monkey?
Yep.
Space monkey. Okay, cool.
Perfect. So just to go over briefly the parameters that we used in Arizona, as was mentioned when they did the demo earlier, it's actually pretty easy. A lot of this data should be readily available in the state surveillance database that you may have. So we put in our case counts per year for each disease, which you can see here. We obviously added the Arizona population. We did, however, for the increase in dollar amount that we hoped for in budget, not what we suspected but hoped for, we initially back calculated from what NCSD put out as a proposal a few months ago, but then we ended up deciding to go with the amount increase that would lead to a 50% reduction in incidence of cases. So we ended up with $7 million for that reason. And then we decided to do the additional page that they went over on DIS because, as Becca mentioned, 75% of our funding is spent on personnel, so it really is important to look at the work that our DIS are doing in the state. So we found out most of this information by looking through our county contracts. And as she mentioned, we found that we have 11 total DIS. We do have more than 11 staff working, but because so much of our state is very rural, a lot of our public health nurses are working in multiple programs, so we just added up all the different people and their percentage of time to land at the number of 11 DIS. We also, through their county contracts, calculated their salary and fringe benefits and landed on an average of about $70,000 per person. And then for the number of interviewed cases per year, we actually got an anecdotal number from each county manager, but then when we looked at the specific percent interviewed for each disease, we used our STD database again, which is PRISM.
So the Voyage of the Arizona Space Monkey actually started about December. I believe a post was put out on the NCSD newsletter that there was this new fact sheet available. And I kind of set it on the side in the back of my head. And I don't know what it was in February, but probably I was cleaning out my emails and I saw it again. And we decided to kick it to our counties. Arizona is pretty particular about the ways in which we ask for funding. Because they don't want any of our activities to ever be misconstrued as lobbying. So there are some restrictions in how we can talk about the funding landscape in Arizona. So we weren't really intending to use it much at the state level initially. But then in April, when NCSD hosted the Day of Action event, and one of our colleagues was invited to do some of the Hill visits. She was a colleague from one of our local tribal health departments. She really wanted to have a good understanding of the challenges that we face as a state in controlling STDs, and she wanted to know a little bit more about the funding landscape. So I had remembered about this fact sheet and this tool and spoke to Kaitlyn to see if we could maybe play around with it to get her some data to inform her visit. And it was really quick and easy. I think Kaitlyn was able to build out the data and the fact sheet in under an hour, which was good because we didn't have a lot of time to put the request together, as April also happens to be when we're trying to close out data and do other kind of high important things. So we prepared the fact sheet for her in addition to some other data that we had just kind of queued to go, so that way she could go and talk a little bit more about the state and what its needs were. And then in May, we were actually selected by the State Health Department as one of the breakthrough projects for the agency, similar to what ADHS has done with opioids. So STD is kind of that, we're currently in the process of preparing an action plan that will go to the governor's office. Additionally, there is a federal STD action plan that has been in the works. So we use some of the findings from our Space Monkey and some of the data points from our Space Monkey to inform both our feedback for the federal action plan as well as to inform what we're building for our state action plan. Kaitlyn and I were actually just working on the expedited partner therapy section of our action plan this morning, and we're like, oh good, gosh, we can start pulling all of the DIS data and you know, the kind of time allocation estimates that were used to create our Space Monkey fact sheet and use it as a justification for why EPT is so important, because there's really a gap in providing DIS coverage for chlamydia and gonorrhea. So we actually were able to use elements of the fact sheet in our action plan as a justification for why some of our metrics are so important and why some of our activities are so important. And then our plans for the fact sheet, we're hoping to revisit this at the local level and reapproach some of our counties to help provide them with the data that they need to create a smaller version of this to help inform their funding scale and their plans, but that'll probably be something we do in fiscal year 2020. We're also thinking of putting elements of the Space Monkey fact sheet on our webpage. Again, there's kind of some limits to what we can and cannot put on our webpage when we're talking about funding. We've had experience with the stick-figure analysis, which is probably going to be what actually winds up on the webpage. But there are elements of this fact sheet and parameters that we'd like to include to provide just more transparency about how we use our STD funds and how we stretch our thinly stretched resources to promote STD control and prevention in Arizona. So that's basically all we have on the subject. If you have other ideas for how we should or shouldn't be using this tool, we're definitely open to it. And then for those who are interested in working with this tool, we'd be happy to answer questions now or do one-on-one conversations later.
Thank you both so much. And I did post a shortened link to the fact sheet in the chat box for everyone, for yourselves, and also to share with your colleagues. In the files box that you'll see to your right on your screen is the Arizona fact sheet that they all use. So you can also look at that as an example from the field. And now we will keep moving forward and have Amanda Reich from Texas speak.
Hi. Hi, I'm Amanda Reich. I'm with the Texas Department of State Health Services, and I'm going to talk about how we've used the Space Monkey tool here in Texas and how you too can ask for more bananas. Oh, Leandra, it does not want to work for me either.
Did you press sync at the bottom right? There we go.
Okay, cool. So a bit of an overview about public health follow-up here in the Lone Star State. Oh, no, this is not wanting to show anything on our screen.
It should
okay,
be
there we go.
There you go.
Okay, so we're an integrated HIV and STD partner services state. We are decentralized, consisting of both regional and local health departments, which make up 18 jurisdictions, providing partner services to 254 counties. It looks a little something like this. All data used is 2017 data, so for a bit of historical context, between 2013 and 2017, there was no increase in the number of grant-funded DIS. We had a 48% increase in the number of overall syphilis cases. We had a 6.7% statewide population increase, and our 2017 APS award was roughly $6 million. And we used this tool and the associated fact sheet with central office STD program staff, and we looked at both the impacts of increases and decreases in budget. So We first looked at the tool with a decrease, and as Harrell mentioned, we have an adorable little monkey to go ahead and begin. And we needed a little bit of information about our program. In 2017, the Texas population was 28.32 million. We reported roughly 145,000 chlamydia cases, 45,000 gonorrhea cases, and we're including all of the syphilis cases because we follow up on primary, secondary, early, and late latent, which was what it was in 2017 syphilis, and we had 11,499 syphilis cases. And again, this is 2017 data. And we went for a 10% budget decrease, or $600,000. And as Harrell mentioned, this is extremely easy. Just keep clicking next. And it asks us, do we want to enter information about our DIS? And so we have to do a little bit of DIS calculations, as Becca mentioned. And we looked at our local health department staff, and they are contracted. So we looked at the contract percentage of the FTEs multiplied by the number of staff supported by grant funds. DIS were counted at a full percentage of their grant fund. Frontline supervisors counted at 50% of their grant funds. Management staff were not counted, and federal staff were not counted either. And so what that means is if we supported the local health department at 80%, then DIS counted at 0.8 FTE, and a frontline supervisor counted at 0.4 FTE. We do not contract with our regional health departments, so DIS all counted at 1.0, and FLS counted at 0.5. The decision to count frontline supervisors at 0.5 was because they do not work DIS work routinely. When we use the tool as a decrease, that's how we came up with our weird 90.35 DIS employed. We averaged all of the salaries and fringe benefits statewide to come up with our annual DIS costs. We left the default values for annual STD cases interviewed, but tinkered a little bit with the percentage of cases interviewed, knowing that most of our jurisdictions do not routinely follow up with gonorrhea or chlamydia unless they're associated with someone who is also diagnosed with syphilis or HIV. And we used our average percent of syphilis cases interviewed. And again, this is all syphilis cases. And again, just letting us know we're getting our results. And we have this great spreadsheet here showing us all of our results. And in the first year, we already see that our total additional costs more than double what we removed from our budget. So we had a decrease of 10% or $600,000, but our total additional cost is $1.3 million. And in 10 years, it's $29 million. So it's a pretty significant argument for not reducing our budget by 10%. So we are an integrated partner services state, as I mentioned, and we had a conversation. We were talking about this at central office. How can we play with this tool a little bit and look at the number of reported HIV cases in the tool? So we changed out chlamydia with HIV and put in our 2017 reported HIV cases, which was around 4,400. And so, this did not transpose well. So our percentage of HIV cases interviewed was right around 85%, so we modified that as well. And again, that gives us over 10 years new HIV diagnoses that could have been avoided is around 1,400. And we realized that this is inexact due to the variable rates of HIV infectivity between chlamydia and HIV, but we felt that it was worth sharing. And a little bit more about our funding sources is our local health departments, as I mentioned, are primarily grant funded, and those grants are distributed by DSHS. Some sites receive supplemental funds by the Texas Department of State Health Services, our general revenue, and some sites also have staff positions that are supplemented by local general revenue, which is, of course, subject to budgetary approval. Our public health regions have predetermined funding set by the Department of Regional Local Health Operations, and those grant funds cannot be awarded directly to a regional health department. So for them to get an additional staff member in partner services, they must reallocate another vacant FTE within that region, and if no FTE is available within that region, they can request an FTE reallocation from another region or within our overall DSHS infrastructure, but then they must go through the RLHO division. So it's pretty difficult to get a new partner services position within a region. So then we decided to look at a local jurisdiction, and this is our local jurisdiction A, and some fast facts about it is during that same time period we talked about before, they had a 7.3% population increase. They cover both the city and the county. They've had no increase in the number of DIS since 2013. And their funding increase kind of mirrored that population increase. It was 7.9%. Their 2017 APPS award was $550,000. We chose this program because it's 100% funded by grant funds. So they serve around 2 million people, and in 2017, they reported 12,500 chlamydia cases roughly, 4,400 gonorrhea cases, and again, this is all syphilis cases because we follow up on all syphilis cases, and it's right about 1,300 syphilis cases. And we decided to be extremely generous in their budgetary increase by giving them 36% budgetary increase, or $200,000. And we have all this disease intervention specialist information where might as well enter it. And so then you can see that we have 9 DIS calculated as before. They have the same default values otherwise, and we put in their exact DIS costs. And as Harrell showed, there's 2 different approaches. There's the historical approach. So this is the historical approach. And in the first year, just investing $200,000, you make that money back. You're going to get a reduction in cost of $315,000, and over 10 years, almost $7 million. So it's pretty significant, not to mention the reduction in overall cases. When we change and see the advanced options and change to the DIS approach and go back to our results, it's much more of an argument, right? We have a bigger reduction in overall cost. It goes from $315,000 to $523,000 in the first year, so you're more than doubling your return on investment. And in the 10-year total, it's $11.6 million. And it asks us to see the text summary, and that's our text summary. As Harrell mentioned, it's really easy, it's really palatable. It's going to give us this range, and the average that it showed us just then with the DIS approach. And then, as Elizabeth mentioned, here's the fact sheet for Texas Jurisdiction A. And we really liked it because it's extremely appealing for leadership. It's really easy to read, and it points out the big picture, right? If you invest $200,000 in the first year, you're getting this reduction in syphilis cases, in gonorrhea cases, and chlamydia, and you're already removing 1 STD-attributable HIV case. And of course, for leadership and decision makers who are going to either invest or decrease in your budget, you can see, hey, if you increase our budget by $200,000 in 10 years, you're going to decrease your costs by $11.6 million. What we really liked about this is the reverse, where we talk about what do disease intervention specialists do, and this $200,000 is going to mean we're going to add some DIS to this program. And I know it's very small and difficult to read, but it talks about, hey, DIS not only interview clients, they get them treated, they notify them, and they can also respond to other disease outbreaks like flu and measles, Zika, Ebola. And we can also do other things with public health emergencies, like respond to natural disasters like flood relief or tornadoes or anything else that's affecting your state. We did have some wish lists for future iterations. There was no option for level funding. When you enter $0 on either increase or decrease, you get $0 back. And factoring in changes just so that we could see what happens if we have an increased disease burden, right, or a change in population, increase or decrease. Maybe including information for congenital syphilis cases averted and that associated cost burden, and options for the number of HIV cases interviewed for integrated partner services states like Texas. And again, all data utilized is 2017 data, budgetary contracts, surveillance, and population. And thank you so much for this opportunity.
Thanks, Amanda, and thanks to all of our presenters as well. So now we'll take questions for any of our presenters. So feel free to type your question into the chat box. I will unmute everyone now. You can also ask it on the phone line. 1 second. Mhm. So while I'm figuring that out, feel free to submit your questions in the chat box. I know we had one earlier from, let me scroll for a little bit. Someone asked, and this question was for you, Harrell, about those studies that you mentioned. It was at the beginning of your presentation where it was the What is Space Monkey slide, where you were talking about the different studies that, hold on, let me find it. It was the what data do I need to in order to use Space Monkey, I believe, around the DIS and around the impacts of STD prevention funding and activities. And she was asking if you are able to share those studies.
Yes, we have the studies in PDF format, and we can send them to you to share with whoever is interested in those, if that's
perfect. Okay.
If that's the question, yeah, that's very easy to do, yes.
Okay, thank you, Harrell. And you said the link that was provided was to that fact sheet that ASTA created with MTSD, the customizable fact sheet, where you take the data from the spreadsheet and put it into the fact sheet in order to share with your internal or external stakeholders. So I hope that answers your question. Feel free to let me know if it did not, but I believe we answered it. George Walton says, Amanda, are DIS in your state funded by multiple programs like STD and HIV prevention? If so, how did you account for that mixed funding in the Space Monkey pool?
So our local health department DIS are funded almost exclusively at this time with Peached. So no, I calculated it based on what the percentage they were funded at the time they were funded through apps. So as I mentioned, the local jurisdiction A, they were 100% funded with apps. Right now they're 100% funded with Peached. Some jurisdictions opt to supplement their salaries with local funds, and so then they were calculated at a percentage of that local funding. So if we fund them at 80%, and they choose to supplement salary with an additional 20%, then I calculated the DIS at 0.8 FTE and the FOS at 0.4 FTE. But we do not supplement them right now with HIV prevention dollars. But our regional health departments, we do not pay with grant funds.
Thanks for that answer, Amanda. George, I hope that answered your question. I did unmute all of your phone lines, so if you would rather speak over the phone line to ask your question, you're free to do so, or you can continue to use the chat box function. Any other questions for our presenters? It can be Harrell over at DSCDP, Elizabeth at ASTO, or either our folks from Arizona, Rebecca or Kaitlyn, or Amanda from Texas. I see some questions, some folks typing in the chat box. We'll give it a second. Awesome. Well, we have our emails listed here. All of our presenters, including myself over at NCSD, if you have any other additional questions and you want to reach out to folks one-to-one, you're free to do so. As I mentioned earlier as well, the recording and the slides will be made available to those who registered for the webinar via email. It will also be posted on the NCSD website for use to all access publicly. My colleague Tiffany has posted an evaluation link within the chat box. I'll ask that you please fill that out in order to inform future webinars, and you'll also be directed to this link once the webinar ends, so please feel free to fill that out. There is a portion of the evaluation that asks for any kind of testimonials. If you would like, you want to share your experience with ASTA or NCSD with using Space Monkey, there's a space to submit your name and email, and we'll reach out to you and get those testimonials from you all. But of course, if you have questions in the meantime, feel free to reach out to any one of us. Once again, I want to thank all of you for attending today, especially this late on a Friday. I appreciate it. And a special thank you to our presenters as well. And yes, I hope everyone has a great weekend and enjoy the rest of your day. Thank you.
Thank you.